2014, the extra effort you invested every day helped us deliver superb quality care, keep patients safe, provide outstanding service, enhance the health of the population, and make healthcare more affordable. Most importantly, you remember the real reason we are here: to improve lives. Strategic plans, new buildings, and improved technology are key to moving us forward, but nothing can compete with the way you treat our patients and their families. Thank you for making excellence common where others have barely started. You make us great. Most importantly, in 2014, we delivered exceptional care across many services. Our quality of care was so high, we received HealthGrade's America's 50 Best and Distinguished Hospital Awards, placing us in the top 1% of more than 4,500 hospitals nationally for consistent overall clinical excellence, and recognizing our superior performance across multiple procedures and conditions. Focusing on our outcomes, HealthGrade's also named us in the nation's top 5% in 8 specialty areas, and in the nation's top 10% in 2 more specialty areas. And Becker's Hospital Review honored us as one of the nation's top 125 hospitals and health systems with great orthopedic programs. Individual departments continued their efforts to improve, resulting in the highest score possible for heart surgery care from Consumer Reports. For the disease management measure, Diabetes All or None process, our La Crescent Clinic was the best performing and our Harmony Clinic was the most improved. After working side by side with patients, families, and staff to design an environment that will improve their experiences, we opened our new hospital, a healing environment that increases privacy, improves our efficiency, and will allow us to provide exceptional care for years to come. Keeping patient safety a top priority, we conducted many improvement projects and developed many new systems. One improvement project decreased the number of women who suffer from postpartum hemorrhage, a leading cause of death in new moms. One new system followed up with patients who had unanticipated abnormalities in their lungs, ensuring potentially life-threatening issues were brought to their attention and addressed. Honors continued to come our way when a national health services company recognized us for excellence in utilization management for ensuring healthcare resources meet patients' specific individual needs. And to provide the highest quality, safest care to more people, we partnered with 6 top-performing organizations to create a first-of-its-kind, multi-state healthcare network. In addition to better care, About Health will result in improved access for patients and better value for employers. It's expected to serve as a model for the nation. Our achievements went far beyond our medical skills. We also worked hard to ensure patients had great experiences when they trusted us with their care. Our efforts paid off, with hospital patient experience surveys placing us in the top 15% in the nation for delivering positive experiences for patients and earning us HealthGrade's Outstanding Patient Experience Award. In a separate survey, 47% of Gundersen providers showed improvement on the question, during your most recent visit, did this provider explain things in a way that was easy to understand? And departments showing the greatest improvement on overall provider rating were Whitehall, up 9 percentage points, Palliative Care, up 7 percentage points, Toma Vision, up 7 percentage points, and Spring Grove, up 6 percentage points. We went straight to the source for feedback and the best ideas, discussing cost of care, the redesign of our billing statements, and other topics at meetings of our patient and family advisory councils. For the accuracy of information provided, short hold times, and low numbers of dropped calls, Gundersen Health Plan's Senior Preferred Medicare Advantage Plan ranked among the best in the nation for customer service and number 1 in both Wisconsin and Iowa for customer satisfaction. We worked hard to deliver outstanding experiences not just for our patients, but also for our most important asset, our employees. Initiatives to lower employee injuries continued, reducing recordable incident rates by 39% since 2004. Our overall efforts to keep employees well were recognized with high honors, a platinum-level START Fit Friendly Company Award from the American Heart Association, and a platinum-level Well Workplace Award from the Wellness Council of America. One wellness benefit, the My Health Reward Program awarded $1.2 million to staff for maintaining or improving their healthy behaviors. The organization spent $69 million for medical, dental, life, and disability coverage for employees, and employees received a retirement plan contribution of 15% of their salary when they personally contributed to receive the full match from the 401k plan. To show our support for our great nursing staff, we helped coordinate a complimentary public showing of the documentary, The American Nurse, Healing America. Outside organizations agreed Gundersen is a great place to work, honoring us with an Excellence in Engagement Award and a spot on the 100 Great Places to Work in Healthcare list. We took on the responsibility of making care more affordable for our patients, communities, and employers. For the 16th consecutive year, rate increases for both the hospital and the clinic were less than the year before. Through improvement work and by paying attention to details, our controllable costs increased more slowly than the rate for other healthcare organizations. Individual departments worked hard to reverse the trend of increasing costs. Over the last 2.5 years, facility operations has reduced their costs by more than $880,000, mostly by performing work in-house versus contracting it out. Central Services took on equipment reprocessing for respiratory therapy, sleep lab, and the training lab, freeing up time for respiratory therapy staff to spend more time with patients. And the revenue cycle team increased our income by $2 million by holding financial conversations with patients before their visits, decreasing denied insurance claims, and with other efforts. More than 110 projects highlighted at weekly improvement recognition events identified more than $1.5 million in financial improvements. We recognized that to really impact the health of the population, we needed to get involved in and address other determinants. Taking into account our pricing, cost of care, financial strength, and more, Cleverly & Associates honored us among the best hospitals in the nation for the value we provide to the community. Along with making care more affordable, growth was important to support our mission and key strategies. While most hospitals in the country experienced declines in the number of patients they saw, the number of patients we cared for increased. The number of surgeries we performed also rose. We expanded our existing telemedicine programs, adding neonatal services in Toma. We launched new programs too, in several specialties in Muscadet and Fenimore. And we worked with the Amish community in Cashton to expand our role in their health services. Using new technology, we celebrated our first pregnancy that used frozen donor eggs and our first in vitro fertilization pregnancy that used sperm surgically aspirated in our clinic. Moving from the beginning of life to discussions about the end of life, Gundersen Medical Foundation's Respecting Choices program was introduced to many organizations, including the largest private healthcare organization in the U.S., Kaiser Permanente. In addition, it was used in a 6-nation research study about advanced care planning. We broke new ground in the healthcare industry for environmental leadership and were asked to share our success at the White House. We reached our first days of energy independence, becoming the first health system in the nation to produce more energy than we consume. 2 new renewable energy projects that turn animal waste into power helped us reach our energy independence goal. The Legacy Building is one of the most energy-efficient hospitals in the United States, consuming less than half the energy of an average hospital its size. Viewing energy conservation as their ongoing work, facility operations reduced energy use in the new hospital even further by making changes to the geothermal heat pump, air handlers, lighting, and more. Positive changes they made also resulted in a dramatic increase in uptime for our biomass boiler. In our emphasis area of waste management, we focused on reduction and recycling. We implemented changes that drastically reduced the amount of hazardous pharmaceutical waste we produce. Today, it's more than 14 times lower than in the past, saving us more than $120,000 annually. And we reached a system-wide recycling rate of 43%, diverting more than 700 tons of waste from landfills. To expand our environmental efforts beyond our walls, we secured a grant from the organization Healthcare Without Harm. The grant will help launch a home-based environmental program for nurses interested in sustainability. Many staff come to Gundersen for the opportunity and privilege of working with doctors in training. Our staff love to teach and enthusiastically share their expertise with residents and student doctors, student nurses, and other health profession students. The quality of our medical education program is evident in our 5-year record of 100% board certification rate for general surgery residents and our 10-year board pass rate of 98% for internal medicine residents. Recognizing the unique circumstances faced by patients trying to live healthy lives in rural areas, Gundersen Medical Foundation launched a new family medicine residency program specializing in rural health care, and expanded our general surgery residency program to increase access to quality surgical care in rural and underserved areas. Our research program helps Gundersen medical staff provide patients with the most up-to-date advancements in medical care. One grant we received will expand clinical cancer research, an area where medical advances are sorely needed. And many of our staff were featured at premier medical events in the United States and contributed to leading medical resources. To improve the health of our communities, we focused on both health care and health, improving physical environments, health behaviors, and social and economic factors. We joined a team of neighbors and local organizations making the Powell, Pogue, Hamilton, and Washburn neighborhoods better places to live, work, and play. Recognizing the many benefits of a healthy diet, we continue to offer an ever-widening array of nutritious, affordable food choices to patients, families, visitors, and staff. The availability of 500 club-approved vending items at Gundersen increased to 90%. And beyond our campuses, our new mobile restaurant app helps people eat healthy when they're dining out. To provide health care to people who might not otherwise receive it, 128 of our community-minded employees volunteered 1,819 hours at St. Clair Health Mission in La Crosse. We also provided care thousands of miles beyond our neighborhoods through global partners. We completed a housing project in Nicaragua that enables 25 families to own their own homes, plant gardens, and raise livestock. And volunteers worked in Yerevan, Ethiopia for the first time after the launch of a new partnership with Project Mercy. Our goal is to improve the overall health of the people there, including housing, healthy drinking water, agriculture, and more. And although awards are never our motivation, we were thrilled to receive the Indian Health Services Director's Special Recognition Award for our ongoing outreach efforts at Pine Ridge Reservation in South Dakota. It's time to be proud of what you've accomplished. And while 2014 was full of huge work, we need to remember this: even the smallest act can have a massive impact on our patients and their families. Our commitment is to take care of people as if they were our loved ones and as if lives depend on it, because they are, and they do. Thank you for demonstrating that we are where caring meets excellence. You make us successful.